Colleagues, this will be the second time the Liberal government is asking us at the 11th hour to save Canada from sliding further down the slippery slope of medical assistance and dying. At first, many people opposed to assisted suicide warned of a slippery slope, only to find out Canada was actually standing on the brink of a cliff. Our concerns have been dismissed since the very beginning, and more forcefully since Bill C-7. While the proponents gave us assurances of assisted suicide being limited to a small number of cases, the truth of the matter is sadly the complete opposite. Since 2019, Canada has seen an average yearly increase of 31.1% in total assisted suicide deaths, resulting in 4.1% of all deaths registered in 2022. And since 2021, the adoption of Bill C-7, Canada registered 222 assisted suicides whose natural death is not reasonably foreseeable, and 463 in 2022. Colleagues, at the current rate, the report for 2023 could indicate over 16,000 assisted suicide deaths, which would represent the cumulative total of 2020 and 2021 in 1 year. Canada has quickly become the world leader in assisted suicide, surpassing countries who have had a similar law for decades longer. According to an analysis by the Investigative Journalism Bureau and the Toronto Star, in the past 2 years alone, more people have died under Canada's assisted death regime than in any other nation in the world. Dr. Sonyu Gain, Chief of Psychiatry at Sunnybrook Hospital, said, "We are on a trajectory that no other country on the planet has gone, while not knowing what the full impact is going to be." At this point in time, colleagues, no one knows what the full impact is going to be. Projections by the Trudeau government have consistently underestimated the number of assisted suicide deaths. According to projections by Health Canada in 2018, our country would reach a steady rate of 2.05% of total deaths attributed to assisted suicide. It gets worse, colleagues. In the update on regulations for monitoring of assisted suicides and dying, committed in May 2022 in the Canadian Gazette, Health Canada has projected assisted suicide-related deaths to reach a steady growth of 4% by 2033. Colleagues, we have surpassed Health Canada's own projection by a full decade by reaching 4.1% in 2022. How can we trust this Trudeau government and the Minister of Health that assisted suicide for mental disorders will only affect a small number of people? The floodgates are wide open, and instead of doubling the efforts in closing them, the government is stuck in its ideology to further open them. Under this government, Canada has moved from having to put in place an assisted suicide regime due to a Supreme Court decision to an expansion of the regime for ideological reasons. The majority of the provinces and territories requested an indefinite pause. No professional consensus can be found to distinguish accurately suicidality from an assisted suicide request. And the majority of surveys find Canadians not in favor of assisted suicide for mental disorders. The last survey from Leger poll was released on February 13th, and it still showed a majority of Canadians against or unsure about offering assisted suicide for solely mental disorders. Let me be clear, colleagues. The debates we had on C-14 were the most compassionate and respectful debates on a divisive issue that I have seen during my time in the Senate. Although we had different opinions, we all came from a place of compassion, empathy, and understanding. And I, too, do have compassion for people suffering, just as much from a physical illness than from a mental illness. I really do, colleagues. Too often, people opposed to assisted suicide for mental disorders have been characterized as uncompassionate, and that's happened here in the past week again. My opposition to assisted suicide for mental disorders is not out of believing someone suffering from mental illness. Mental health is less than someone suffering from a physical ailment. It is based on a lack of evidence and a lack of safety of such an expansion, as well as a strong belief that the government should be putting more efforts into offering better quality for mental services. The federal government should be helping psychiatrists and all mental health practitioners to improve services to help Canadians who are suffering instead of facilitating the path to suicide. Colleagues, I, like you, have friends and relatives who would not be here today if they had been given a choice on a day of depression under some of the laws that we are proposing. And they are living productive lives. Canadian Physicians for Life agrees and stated the following in its submission to the Joint Committee on Resource Shortages. With acute human, financial, and material resource shortages in mental health care and services, it seems counterproductive to commit those resources to expanding MAiD to those whose sole condition is mental illness. We have seen a significant number of resources expended on the healthcare system to make MAiD available for those at the end of life. More resources have been added to expand MAiD to those who are dying. It will create cognitive dissonance on the healthcare system to expend more resources to run parallel systems of suicide prevention and suicide assistance. In 2022, Statistics Canada reported that over 5 million Canadians aged 15 and older met the diagnostic criteria for mood anxiety or substance use disorder in the previous 12 months. In the same survey, it showed that more than 1 in 3 Canadians who have a mood anxiety or substance use disorder said their health and mental health care were partially or fully unmet. Finally, the survey concluded, and I quote, "Increasing the supply of healthcare providers who focus on mental health and have specific training in this area is one of the many possible solutions to improve access to mental health care in Canada. However, disparities in health insurance coverage for medications and counseling services also need to be addressed." Furthermore, a poll released in September of 2023 by Angus Reid Institute found that a vast majority of Canadians concerned with the mental health resources available in the country, as well as the state of Canadians' mental health overall. On the following statement, MAiD eligibility should not be expanded without Canada improving access to mental health care first. 82% feel mental health care should be improved first before MAiD eligibility is expanded. Finally, half of Canadians worry that treating mental health won't be a priority if MAiD eligibility is expanded. Colleagues, during our Committee of the Whole, I was so disappointed when the Minister of Health kept talking about the need to train more nurses and more psychiatrists in evaluating if a patient with a mental disorder could qualify for assisted suicide. Canadians are saying the exact opposite. More training and resources are needed to help patients suffering from mental health illness to recover and live well, not to determine if they qualify for death. They'd rather see the federal government put in more efforts in improving mental health services instead of expanding assisted suicide. The Canadian public is clear. More needs to be done to improve mental health services in Canada. Until Canadians have equal access to affordable and quality services for mental health and physical health, until we have evidence on how or if we can medically and accurately detect who will not improve from mental illness, we cannot legislate access to dying from mental illness. While I disagree with assisted suicide in general, I cannot change that. But just like I can't change assisted suicide in Canada, the Trudeau government cannot continue pushing on Canadians the expansion of an assisted suicide regime for mental disorders with the lack of general consensus from professionals and Canadians.